With COVID now, this is a moment that's just extraordinary around how important it is to have very timely, accurate digital communication.
That's the voice of Miriam Paramore, president of OptimizeRx, explaining how the coronavirus pandemic is motivating the healthcare industry to engage with digital solutions in ways we've never seen before. You're listening to How I Transform This, presented by Versus 12. Versus 12 is the award-winning Salesforce Gold consulting partner focused on healthcare innovation nationwide. In this episode, Miriam shares how her company is taking the tools they've already developed and using them to help patients and providers stay informed in the midst of the coronavirus outbreak. She also explains how these digital communication tools are transforming the healthcare industry by helping improve access, affordability, and adherence.
For us as a company, it just puts a spotlight on why it's so important to communicate digitally as an industry. We have, in this case, the CDC on the back end that's getting data from the World Health Organization, literally minute by minute, and we're distributing that out to the world.
I'm your host, Clark Buckner, and along with Versus 12 founder and CEO Tammy Hawes, each episode we're seeking out healthcare technology industry leaders, exploring stories of success through the transformation of healthcare. For more stories like this, visit versus12.com/podcast. And from our team to yours, be safe out there, follow CDC guidelines, and be ready to hunker down. Together, we can get through this. All right, let's jump into our interview with Miriam.
Hi, my name is Miriam Paramore. I am president of OptimizeRx.
Thank you so much for taking the time to jump on this podcast with us.
Thank you, Miriam. You are such a dynamic leader in the digital health space, and things are happening so quickly now with the current crisis that I'm so excited to see what you have to say today.
Thanks, Tammy. I'm really excited to be here. It's just a lot of fun to get a chance to chat with my peers like you in the industry, especially female entrepreneurs who have created successful tech businesses. I admire a lot what you've done with Versus 12.
One of the reasons I love getting to co-host this with Tammy is I get to meet all of her really cool friends in the industry, and I'm learning a ton through this. So if you could, just give me a quick snapshot of what you all are doing as a digital health company and also the big problem that you're working to solve.
Yeah, great. Sure, I will. And I'm going to segue into what's happening right now with the coronavirus global pandemic, which is, it's difficult to even say those words and know that they're actually true versus hyperbole. But OptimizeRx is a digital health communication platform. And what that phrase means is that we connect various stakeholders in the healthcare industry and help them to communicate to each other digitally. We're in a very unique moment in time right now where we need to be able to communicate effectively and communicate digitally because we literally can't see each other in many cases because of the quarantine. But to back up and give you sort of the history, the business was started a little over 10 years ago, but really had a fundamental reboot about 4 years ago. So it's a really new, growing, fast growth company that was started based on the change in communication between the life sciences industry and the point of care or the provider community. There used to be reps that were sent out to the office to educate on drugs and new indications, and that changed over the years. And there, at the same time, that changed to less in-person access. The rise of the EHR happened. So the business was born from being able to supplement clinical information pathways that used to happen in person, where doctors would get educated about new drugs by representatives from the life sciences companies, to let's share some of that information digitally and let's share it at the point of care in their workflow because they're spending 5 to 6 hours a day in their EHR. And that was kind of the origin of the business. And how that evolved into the problem that we're solving today or helping to solve is really we have a huge medication affordability issue. We have an enormous problem with medication adherence, which drives up cost, and we have, pretty poor outcomes. And then we have care management issues. So care management over time, whether you start with wellness or start with illness. So we're focused on helping the industry perform better and helping patients get better quicker by focusing on access, affordability, and adherence.
So Miriam, I know you're doing some really fascinating and transformational things right now to help with the problems that are being created with the coronavirus related to provider communication. So tell us a little bit about your industry apps and your SMS apps and even some of the transformation that's happening with communicating with the patients.
Yeah, it's been, this is a unique moment in time. So we all know that we live in a digital world now and that most of us use our smartphones to do everything. Physicians and healthcare providers use their EHR to do most of their digital work throughout their day, managing patient flow and clinical content. They spend 5 or 6 hours a day there. So that's an industry transition that's happening. It's transforming. But with COVID now, this is a moment that's just extraordinary around how important it is to have very timely, accurate digital communication. So for providers who are still in their offices right now and in hospitals, they're getting across the country as we get more and more information about where the virus is, where the tests are, that sort of thing. We used our digital communication network to push out to hundreds of thousands of healthcare providers who are connected to our network these messages into their EHR. So we had these railroad tracks, if you will, that we were using and continue to use for life sciences and clinical messages into the point of care. And now we added to that a push of the CDC's most latest information into their EHR so that as they're sitting there kind of doing their normal work, rather than, go to a different browser and kind of look up CDC to see where things stand. This is so dynamic. We thought it was a small thing that we could do to be helpful. So we put that in the field on March the 9th. And then we put into the field a free SMS-based, smartphone, text-enabled based solution for patients, and that's part of our patient engagement solution. So again, we know we're in a digital world. Everything happens on a patient's smartphone or a consumer's smartphone. When we have a set of patient engagement tools that help patients specifically with specialty medications that are expensive and difficult to take, and they include patient support programs that are typically done by a call center or by mail. We've digitized all that and made it interactive so people can capture real world evidence and they can track their care pathway, but they could have a digital conversation with a nurse or a coach as they're going through their treatment plan. So since we already have those commercial tools available in the market, we created a version of this for COVID-19, and anyone that hears this and anyone that you guys can share it with as you're doing this interview, just text the word virus, VIRUS, text virus to 55150. That's text the word virus to 55150, and that will come back to you and say, do you want to receive the latest CDC guidance? And we created a little app with guidance from the CDC on, prevention and identification of symptoms for consumers out there. And again, it's another way to use our network to help digitally spread in real time, very clinically relevant information. So that's a lot that I've said there. Let me just add one little piece, which is, we all have a lot of apps on our smartphones, but often we don't want to open up or load a new app, but everyone likes text. And so that's why we have focused on interactive text messaging to be an easy way for patients to engage in the healthcare system. So that's how we're taking our basic tool set, the products and services that we provide every day, Tammy, and pivoting them for use specifically for COVID.
So that is the true definition of what we talk about on this show related to transformation and transformation in healthcare. There's so many things that just take a long time to bring to market. And it's just fascinating how you have taken your platform and within a 2-week period produced extremely valuable applications for both the provider and the patient consumer that are very, very relevant. So kudos to you.
Thank you so much. It's interesting, Tammy. I'm sure you're seeing this in your own life and in your own, family, friends, and I'm sure with your company, you have these extraordinary moments and you're like, what is happening, right? It just seems so surreal. And then you ask yourself, what can you do to be part of any sort of a solution? What can we offer up? So for us as a company, it just puts a spotlight on why it's so important to communicate digitally as an industry. So, we have, in this case, the CDC on the back end that's getting data from the World Health Organization, literally, minute by minute, and we're distributing that out to the world, and we're making decisions that have huge impact on people's lives and huge impact on our economy and huge impact on global factors. And so to see us be able to move so quickly with our partners to get this stuff out to the point of care, it shows what you can do when you're motivated, right? When people are really motivated to work together. This isn't a day-to-day thing, so the speed is there. What I love about it in the transformative part, which again I'm sure you have, is that you can transform quickly if you have the basic building blocks to do so. And in our case, we've invested in a very nimble AWS cloud-based infrastructure. And then we have these railroad tracks that, as I call them, the digital railroad tracks that connect the point of care to the patient, to life sciences. And so then it's about, how are you going to light up those railroad tracks? I'm mixing my metaphors now. But I have been in the industry for a long time, and I like seeing this speed. We wouldn't have been able to do this 10 years ago with the tech we all had. We can do it now, and you're seeing a lot of companies lean in. That part is gratifying.
Yes, I agree. And you're exactly right. We couldn't have done this 10 years ago. The technology didn't exist. And I don't know if you've heard, but Salesforce is actually offering free health cloud licenses for use for all the calls that are coming into the healthcare providers.
Wow. Mm-hmm.
Related to the coronavirus. And, we have these plans with them to implement that very quickly. I'm talking about a matter of days to get them up and running on these free licenses. So that's the way they're trying to help the healthcare community. So if anybody out there would like to know more about that, just please reach out to us at Versus 12 and we can tell you how that works.
I think that's a great example of everybody leaning in. And, when I think about what you've done, Tammy, is with Versus 12, and I'm sure you've talked a lot about this, but that it's complicated to manage a provider network. And one of the things that we're seeing is, telehealth. We've been sort of struggling to ramp up in telehealth as an industry, whether it's a reimbursement issue or whether it's a technology issue or a trust issue or, or just an inertia issue. Now you're seeing that, even doctors on this big clinical call with chief medical officers late last week, saying we want to take telehealth visits. We don't want people coming in person when they don't have to. And you're seeing hospital systems that are dealing with, the onboarding sort of funnel problem, which is they may not have enough employees to take on the surge of, intake in the ED or in the clinic setting. And then you may have workers who don't feel safe coming, right? So it's another transformative moment, and we're seeing a spike. You can see it in Teladoc's stock. You can see it in the spike of, demand that's around telehealth solution providers. So I think that's a way to think about digital health being right for the moment as an industry. And I'm just curious about how your provider network management stuff, what are you seeing with telehealth providers coming on board if somebody doesn't have that infrastructure or those railroad tracks?
I mean, yeah, it's just like the old-fashioned way of finding a provider. You've got to know, if you're a telehealth network, you've got to know who's in, who's available, what specialties they have, how you get the right patients with the right insurance to the right provider. So that's where we live. And then the fact that providers are constantly changing. They're changing their types of specialties. They're changing what states they can practice in, their licensing. And 10 years ago, it was virtually impossible to keep this data up to date. It's still not easy, but with the technology that we're able to bring up very, very quickly and the use of AI matching this data together, it's something that we can keep up to date very easily.
We want the patient to connect with the doctor and at that point in time share this information about the prescriptions in particular that they're going to be leaving the office with. So whether those are routine retail pharmacy sort of, antibiotics or, cholesterol medicine or whatever it might be, more than 95% of the time, there's a coupon or a savings opportunity available, either a generic coupon or cash card coupon or a branded pharma copay coupon. And we distribute all of those in real time to make it cheaper for patients to afford their medication. Because like so much of this information we're talking about, it's really just getting the information shared digitally, just letting people know that it exists. And then they can act on it. And if you're there with the doctor or getting discharged from a hospital and you know that you can save some money, it makes the difference between, getting your medication and not getting your medication. And then after that visit, after that inpatient stay or that doctor visit, Tammy, it's how does the healthcare provider and the patient, how do they stay in touch? And that's where the patient engagement text-based solution is so critical. So it's not just about an appointment schedule, even though that's important. It's about taking these medications over time and the onset of complications and any adverse event you might have or fear you might have. If it's an injectable and you just don't want to do it, or you're sad because there's some kind of rash that happens as a side effect, right? It's emotional support, which is a key piece to it. So, I'm learning about social isolation, aren't you?
Oh, yeah.
Right. And it's social isolation is a real thing. So being able to digitally communicate with somebody via text, it helps you feel connected. Being able to do telehealth consult if you need to. We've seen the rise of both of these things in behavioral health. So with our network, we're just really focused on using technology to improve these communication channels between patients and providers, and specifically life sciences, because that's the information about the life-saving drugs that they're taking that also have a huge financial impact. So that's what we do as a company. But as a trend in terms of transforming, we're just really trying to help the industry understand that they can connect digitally. You know what I mean, Tammy? You've been in the industry for a long time. It takes healthcare a long time to embrace these technologies. So that's a lot of our transformation focus is how do we help the industry transform to use these tech tools. And now is an interesting time because they can see it. With COVID, it's like, well, yeah, send me the information versus putting up a barrier to say, well, why do you want to send me this information? You know what I mean?
Yep.
It kind of highlights how tech is just a really good communication tool.
So that brings up a really great point that sometimes it's hard in healthcare to make change occur. The environment we're living in today with COVID is forcing that change because they don't have a choice. And I'm wondering if it will, we'll all get over this eventually. I hope that some of the acceptance of digital health and SMS text messaging and instant access that we are forced to use to solve this crisis we're in will actually carry on and will be used just in day-to-day convenience for helping patients get well.
Yeah, that's my hope too. And there's always we always kind of try to have a silver lining. Yeah, Tammy, you mentioned something I know I'm curious in the work that you're doing right now, Tammy, especially around credentialing. I think the president's speech the other day when it talked about we're in a national emergency some of that meant that being able to practice across state lines might be possible, whereas it's normally not. You have to be licensed in it or whatever. How is that showing up in your world, or is it showing up in your world?
Well, it's not showing up yet, but, credentialing is a major part of what we are providing as part of network management. And then, we could go on for hours about pricing transparency and not really truly being able to show pricing transparency to a patient without knowing the active network that they're in and what providers participate and what the costs are. But, as you said, maybe this is the silver lining and some of these rules will be bent slightly as we move forward.
I just think that this is a great moment to ask ourselves those questions, and then service providers like you can say, hey, I have a way to solve that problem. That, if you've got a physician access problem and a patient access problem, and, and it's all going to be telehealth, then let's link that up with network management that deals with telehealth in a different way.
Yeah.
Across state lines. So that kind of thing is exciting. And, we have a lot of compliance things that we have to respond to in terms of the types of messaging that we provide. Again, we don't do the content, but we have a section of our digital conversation that is, clinical in nature. So we have to make sure that it is appropriate for, clinical use in the treatment setting. And then, of course, the content that's provided around the specialty drug regimen, that's all driven by the compliance department of the life sciences industry. So that's all compliant. But even the delivery of any content is driven by privacy and security, as we all know. And then you have things like just, can this patient talk to this doctor about this stuff and it be a reimbursed, healthcare episode? And that doesn't happen if you have a credentialing, kind of conflict. So
Right.
It can get really complicated.
It is extremely complicated.
Yeah. So anyway, I kind of see that transformation of how care is delivered. If you're in network with a health plan, but you're in network only for face-to-face visits, can you be in that? How would a patient know, to look it up and the telehealth? And then and with us, it's digital connections, connecting as many points of care as we can to this timely affordability and, patient safety information about all these drugs. But can we digitally get the connections there through the business hurdles? And sometimes that's an issue. And then can we do it via privacy and security? We're high trust certified for all that stuff and more. GDPR and TCPA, all the texting rules and consumer privacy rules. So, and then the clinical content has to be pristine and appropriate. So it's not as easy as I was, saying or making it seem before. A lot of layers to it, digital communication.
This has been super interesting to listen to, and I love that concept you talk about with this digital railroad tracks, and there's this connecting care and life sciences and providers. And one of the things I want to return to is that texting service that you're using, and it's also what a cool flag to call out. I mean, some of the most transformational things can be really simple texting. So can we hear more about? And I texted it earlier. I've been getting some of these little updates and notices. So I'm just curious about that part, especially how you're working to get that content from the CDC. Anything you can add here?
Yeah, well, there were a couple team members on our team, Serge Loncar, who leads our patient engagement product line, who built what you're seeing, and then Rebecca Whitney, who leads all of our marketing and PR and communication and things like that. Rebecca literally just we had this idea of this other guy, his name is Adam Sokol, on March the 5th, which was the day that HIMSS was canceled. Adam Sokol said, hey, why don't we push this CDC information into the EHRs to make it easy for doctors. We literally did that in one day. And what Rebecca did was she just said, hey, listen, we just want to push what you have into the EHR. What's a safe and simple way to do that? And so the way we did that was we just put a very simple link in there. This is in the EHR, and just said, for the latest CDC update, click right here. The value of what we brought to them is that they don't have to go look for it. It's pushed to them. So if they're in their EHR on anything they're doing, they can just hit it and it goes right there, and then they come right back where they were. So it's, it's a simple, it's distribution, right? Push versus pull. So that's that value. Then when we got ready to do the consumer-based, text-based thing and said, well, how do we make sure that we are in lockstep with the very most timely information, and then we're repurposing it in this app, daily. And it's the same way that we work. We do that when we work with life sciences for a specialty drug. It's just that it doesn't change every single day. And in this case, it does change every single day. So we've had to work out a process to have the most current stuff, pulled over. But really, it just was calling people based on, people that we knew, and then making some simple, and Tammy, you know what I mean here, some simple technology product choices. You're not going to be more authoritative than the CDC. So, how do we get people that in a consumable way? That's the thing. It's consumable, right. Accessible information, consumable information.
That's fascinating. And it just shows you what you can do if you are in this space and you know people and you get an idea and you want to make something happen. So kudos to you.
Thank you so much. We're very, very proud of our team. And a lot, like everyone, we're just like you guys on the phone. We're just all in this together, and we're trying to figure out what can we do, to help, and then do it. And I'm really excited about this podcast happening today because, your title, How I Transformed This is how, not me as a person, but we as a team at OptimizeRx, and we as an industry, including Versus 12, that's how we're transforming this extraordinary moment. And, we're calling it Lemonade from Lemons, but I'm just grateful. I'm grateful for the chance to talk with you guys today and share this information and hope that anyone out there can use it.
And we're so glad you took the time to do it. And it's just so relevant to today. So thank you so much for that.
Thank you very much.
You're very welcome.
Thanks for listening to How I Transformed This, Success Stories of Transformation in Healthcare, presented by Versus 12. To learn more about how Versus 12 is best situated to transform the healthcare industry and to follow along with this show, be sure to visit versus12.com/podcast. We'll see you next time.